Welcome. We've got quite a collection of material here today. Articles, notes, research summaries, all focused on one specific plant.
That's right. And our goal is really to dig into this information and pull out what's most important, what's most interesting about it.
We're talking about Cryptolepis sanguinolenta. Maybe a name you know, maybe not, but uh, these sources definitely paint a picture of a plant with quite a history.
Yeah, a long history and a whole range of properties that, scientists are now looking into very closely.
So our mission really is to unpack what these documents tell us. What is this plant? What are its traditional roots, pardon the pun, and what's the science saying, the good and the potential downsides?
Exactly. Let's just dive right in.
Okay, first things first. What is Cryptolepis sanguinolenta? The descriptions say a woody climbing shrub from Africa.
That's the one. It's native to West and Central Africa. Picture a sort of scrambling shrub, thin stems, quite vine-like, actually. It climbs over other plants. It's got these nice, shiny green leaves, yellow flowers that are kind of tube-shaped. And they can get pretty big, maybe up to 8 meters or so.
And the crucial part, according to this material, seems to be the root.
Yes, definitely the root. That's what's used traditionally for medicine, and it's also what most of the modern research is focused on.
And it has another use too, right? Something about dye.
Yeah, that's interesting. The roots produce this really vibrant yellow color. So historically, people used it as a dye. It even got nicknamed yellow dye root in some places.
Huh. So what's in these roots that makes them, well, active? What are the compounds?
Well, the main players highlighted in these sources are a group of compounds called indolequinoline alkaloids.
Oh, wait, alkaloids.
Right. And the most famous one, the one considered sort of the primary bioactive component, is cryptolepine.
The cryptolepine.
Cryptolepine. But there are others too, related ones like isocryptolepine, neocryptolepine, quinine, a whole family of them, plus other things like tannins and flavones. But cryptolepine, that's the one getting a lot of the attention.
Makes sense. So moving on to how it's been used traditionally, the sources really stress its history in West Africa.
Oh, absolutely. It has a really long and diverse history in traditional medicine there.
What kind of things were people using it for?
The lists in these documents are pretty broad. They mention malaria quite prominently, also bacterial infections, especially respiratory ones, hypertension, so high blood pressure, diarrhea, wound healing, quite a range.
Malaria seems like a big one. I saw a note here calling it Ghanaian quinine. That's a strong statement.
It really is. And it reflects how important it was, and perhaps still is, for treating malaria and fevers in that region. It was a go-to remedy.
And how would they typically prepare it?
Usually as a decoction, basically boiling the roots to make a strong tea, or sometimes as a tincture and alcohol extract. Standard traditional methods.
So these traditional uses, they basically laid the groundwork for the modern research we're seeing now.
Exactly. That's often how it works. Science picks up on these long-standing traditional practices and tries to understand, what's chemically going on.
Okay, let's shift to that research then. What are scientists finding when they study Cryptolepis in the lab or in trials?
Well, they've looked into quite a few areas, often starting with those traditional uses, malaria, for instance.
Right, the Ghanaian quinine.
Yeah, and the research really backs that up. Studies confirm it has potent activity against the malaria parasite, Plasmodium falciparum.
Potent how?
Well, one source mentions a clinical trial in Ghana using Cryptolepis in a tea bag form. It showed a 95.5% cure rate for uncomplicated malaria. That's quite high.
Wow, 93.5% in a trial. That's impressive.
It is, and some lab models even show its effectiveness is comparable to standard drugs like chloroquine or quinine, though resistance patterns always complicate things, of course.
Okay, so strong evidence for malaria. What about other infections? You mentioned bacterial ones earlier.
Yes, there's significant evidence for antibacterial effects. It's shown activity against some really tough bacteria.
Like what?
Things like Staphylococcus aureus, including MRSA, the resistant kind E. coli, Salmonella typhi, which causes typhoid fever, Klebsiella pneumonia, Pseudomonas aeruginosa, some serious pathogens there.
Mm.
It's even shown activity against the tuberculosis bacterium, Mycobacterium tuberculosis, in lab studies. And interestingly, it might even boost the effectiveness of some existing antibiotics.
That synergy idea is really important with antibiotic resistance being such a problem.
Yeah.
What about microbes beyond bacteria? Fungi? Protozoa?
The sources mention those too. Antifungal activity against things like Candida albicans, yeast infections and Aspergillus, and antiprotozoal activity against Entamoeba histolytica, which causes amoebic dysentery and also Babesia, which is another tick-borne parasite.
So that connects back to the traditional use for diarrhea and dysentery.
Precisely. It seems to have a pretty broad spectrum against various kinds of
It
microbes.
really seems to cover a lot of ground pathogen-wise. Does it do anything for inflammation or pain that could relate to wound healing?
Yes, the research points that way too. Anti-inflammatory and analgesic pain-relieving effects have been shown in studies, reducing swelling, reducing pain sensitivity, sometimes comparable to aspirin in animal models, so that traditional use for wounds makes sense scientifically too.
Okay, this is fascinating. The sources also hinted at effects beyond just infections and inflammation. What about areas like, say, blood sugar or even cancer?
Yeah, there's some really interesting, though often still preliminary research there. For diabetes, studies suggest it might help lower blood glucose and insulin levels.
Oh,
Well, potentially improving the body's lipid profile, like cholesterol, and helping cells take up glucose better. Again, mostly lab or animal studies so far, but suggestive.
and cancer.
In cancer research, it's shown promise in lab settings by doing things like inducing apoptosis, that's programmed cell death in cancer cells, and blocking certain pathways that cancers need to grow. Still early days, but definitely an area of active investigation.
Right, and I think I saw something about cardiovascular effects too.
You did. One specific compound, isocryptolepine, was linked to helping clear LDL cholesterol, the bad kind. The whole plant extract might help lower total cholesterol and LDL while maybe boosting HDL, the good cholesterol.
Mhm.
And there's also research suggesting it might help relax blood vessels, that's vasodilation, and potentially reduce blood clot formation, so antithrombotic effects.
It's really quite something how one plant can seemingly touch so many different biological systems. What about the mention of Lyme disease? That caught my eye.
Yes, Lyme. This
Yeah.
is mainly based on in vitro work, so test tube studies. It's important to stress that.
Okay, lab studies.
Right. But in those studies, Cryptolepis extract was found to be really effective against Borrelia burgdorferi, the bacteria that causes Lyme.
More effective than standard treatments.
Well, what was notable is that it worked well against the persistent forms of the bacteria, the ones that can sometimes survive antibiotic treatment in the lab, even forms resistant to drugs like doxycycline.
That sounds potentially huge for Lyme.
Potentially, yes. The sources do mention anecdotal reports from patients suggesting benefits, but they strongly emphasize, and this is crucial, that proper clinical trials in humans are absolutely needed to see if these lab findings hold up in real-world patients. We can't jump to conclusions based only on in vitro data.
Absolutely. That distinction is vital. Okay, so we've covered a lot of potential benefits and mechanisms explored in the research, but like with anything powerful, there's usually another side to the coin, safety. What do the sources say about the risks or downsides?
And this is just as important as the potential benefits, maybe even more so. The sources are quite clear on this. While it might be okay at lower, perhaps traditional doses, high doses can definitely be toxic.
Toxic in what way?
The sources mention concerns about cytotoxicity, meaning toxicity to cells directly, and also genotoxicity, which means potential damage to DNA, especially at higher concentrations, and particularly linked to that main compound, cryptolepin.
So dose really matters here.
Absolutely. It's dose-dependent toxicity shown in cell studies. Another point raised is that it might increase stomach acid secretion. So at high doses, that could risk irritating the stomach lining, maybe even leading to ulcers, especially if you're already prone to that.
Good to know. For anyone with a sensitive stomach, are there other really significant warnings or reasons someone shouldn't take it? Contraindications.
Yes, a very, very important one highlighted repeatedly in this material is reproductive toxicity.
Okay.
Animal studies showed pretty concerning effects, things like reduced sperm count in males and a high rate of abortion or fetal harm in pregnant mice. The sources use the term embryotoxic, toxic to the embryo.
Wow. So definitely not for pregnancy or breastfeeding.
Absolutely not, based on this evidence. The strong recommendation from this data would be to avoid it completely if pregnant, breastfeeding, or even trying to conceive. That's a critical safety warning.
That's essential information. Anything about liver or kidney health?
The sources suggest that long-term use or high doses could potentially lead to liver or kidney enlargement, based on some studies. It also seems to affect certain enzyme systems in the body, which could, interact with how other drugs or substances are handled. And remember, the traditional use for hypertension, high blood pressure.
Yes.
Well, there's a bit of complexity there mentioned in the sources. While used traditionally for it, some lab research on cryptolepine suggests it might actually have effects that could counteract blood pressure lowering or maybe even raise it under certain conditions. So the traditional use and the compound's specific actions might not perfectly align, or it could be dose dependent. It's not straightforward.
So the overall picture from these sources is promising research in many areas, but coupled with really significant safety concerns, especially at higher doses or for specific groups like pregnant women. Caution seems key.
That sums it up perfectly. You have to look at the potential alongside the documented risks and the contraindications. It's about having that full, balanced understanding based on the information available. And there's one more point the sources touch on, looking towards the future: sustainability.
Ah, yes. The risk of overharvesting it in the wild because people are interested in it.
Exactly. Since the root is the part primarily used, digging it up from the wild isn't sustainable if demand grows too high. It could endanger the wild populations.
So what's being done?
Well, there are efforts underway to cultivate Cryptolepis commercially. Research is looking into the best ways to grow it effectively as a crop. That's really important for conservation, ensuring it's still available without wiping out the wild plants.
It really is quite a journey we've traced today through this material, isn't it? From its deep roots in West African traditional medicine for major health issues like malaria, right through to modern science investigating all these different pathways: antibacterial, antiprotozoal, maybe even impacting metabolism and cardiovascular health.
It truly showcases the incredible chemical complexity hidden within plants. But as we've seen, it also really hammers home the importance of rigorous scientific study, not just for efficacy, but critically for safety.
Yeah, those safety points, especially regarding reproductive health and the dose-dependent toxicity, are stark reminders from the sources.
Absolutely. Understanding the full picture, the potential, and the risks laid out in the research is crucial.
And this whole exploration today was guided entirely by the specific sources you brought, giving us this focused snapshot of what's currently understood and what still needs more investigation about Cryptolepis sanguinolenta.
When you take it all in the potent chemistry, the breadth of biological effects seen in studies, and the essential safety considerations, it leaves you thinking, doesn't it? How do we best navigate that intersection of traditional wisdom and modern scientific evidence to responsibly understand and maybe utilize powerful botanicals like this one?
That's definitely something to ponder as you continue to explore and learn more.